Hi, my name is Kellyanne Pastucha. I am at Eline Orthodontics in Frisco, Texas. Let me tell you about how a trip to the physical therapist for shoulder pain led a man to the orthodontist. And what resulted was a significant decrease in his snoring and the best sleep of his life. Let's meet Jeff Reed and Dr. Yoon Chang. So Jeff, my first question is to you. Tell me what the issue was that you first started noticing as a problem and what brought you to Dr. Chang.
So several years ago, I had a sleep study done, and it said that I snored, and that's what was affecting my sleep. So spoke with the sleep doctor, and she said, I don't think a CPAP is needed, but here's a sleep device, like a mouthpiece, and here's a dentist that she referred me to. I said, okay, great. Went and saw the dentist. Shortly thereafter, I got a sleep device, and it seemed to be great, helped my sleep. All that I was told was you wear the sleep device, you get up in the morning, you either chew gum or chew on this little rubber stick, and that's what you do. And so fast forward a year later, had been wearing it every night, saw another dentist for something completely different, and he noticed that my top and bottom teeth were aligned instead of the lower teeth being behind.
What was the sleep device supposed to do? What was its function?
It holds your jaw forward, therefore opening your airway so you don't so you can breathe more easily instead of I think when you snore your jaw kind of can fall back, collapsing the airway.
Okay.
So he said stop using that immediately, which I did. Ended up getting a non-risky sleep device after that, and everything seemed to be status quo from my perspective, but was also having some health issues regarding my shoulder and my hip. And was meeting with a physical therapist that she takes more of a holistic approach, how the body is all connected, so you can't just treat one individual area. And she noticed that I had an open bite, and so told her the story I'm telling you now, and so we talked about how that's not sustainable. She didn't know the extent of my open bite, and in terms of how many teeth were touching or were not touching, but she just said I think it would be wise to go see someone that could maybe help you realign your jaw and get all your teeth to touch, because that's part of kind of you think of your body as a chain, and when one link is broken, it can affect other areas. And she had a daughter that had a bad experience with another orthodontist, and she had found Dr. Chang and thought he was excellent, and again aligned with her view of the body being it's a holistic approach. You don't just shift the teeth around without being mindful of how it affects the overall structure.
So you go in to see a physical therapist about, you said, shoulder and back pain?
Yeah.
And she tells you, go check your teeth?
Yeah.
That's probably not what you thought you would hear from her, right?
Yeah, it wasn't, but I mean, I've just been involved with sports, and it's not my career now, but I've always been fascinated with the body and understand and learning how things are interlinked. And so just her saying that, I didn't think it was crazy. I had never I didn't know orthodontists work that way in terms of taking more of a holistic approach. And aesthetically, my teeth were straight, and I had braces when I was 10 to 12 years old, so I didn't I didn't think I needed braces, and I wasn't cognizant of an open bite. It's just one of those things that, all right, I know my jaw shifted forward and I couldn't move it back, and was just living with it. So I didn't really know the extent of it until I saw Dr. Chang, and he was looking at it and just showed me how only 2 teeth on each side were touching, and you don't have to tell me much to know that that's not sustainable, right? We're made with all of our teeth for a reason, so to just be using 2 teeth to chew is that's not gonna that's not a lasting.
Right. That's
just not.
It's not gonna.
It's not gonna go
be a
well.
good solution for the rest of your life. No.
That's right.
And so, Dr. Chang, let's get to you. You said this is not his case is not an isolated kind of case, and in fact, this is something that a lot of, particularly men, you said have an issue with. Tell me about that.
Yes, there are a lot of men with a diagnosis of a mild to moderate sleep apnea, and many of them they go towards the dental approach, having a sleep device just like the one that you had. So these appliances position the jaw forward. The good thing is that with the jaw position forward, now you have an increased airway, and most of the time snoring decreases, and you have a easier time breathing. The downside is that through time, there's a lot of adaptation happening inside your joint, and it's not uncommon to hear patients who can no longer position the jaw back. The entire jaw comes forward and sort of stays there.
Yeah, it's stuck there.
Stuck there, And then, so in the morning, your jaw is pushed forward, just like Jeff said, chewing on a gum, or there's a little jig to reposition your jaw. You're kind of pushing it back slowly, and then suddenly it goes back. And then at nighttime, you wear the appliance again, and you're pushing your jaw forward. But ultimately, that produces, not every time, but throughout the years, I've seen quite a few people having open bite. And then the open bite is sometimes so much to the certain extent that is very dramatic. The everyday things like even brushing the teeth, it becomes a big issue because patient can no longer seal the lip to keep the mouth inside keep the water inside the mouth.
Inside their mouth.
Mm-hmm.
Exactly. So I've seen those cases as well.
What is that risk something that is addressed when giving these sleep devices?
I'll say yes, in a way, because in that consent form that a patient signs to get sleep appliances, there's always a clause saying that there will be dental changes. And one of the dental changes may be open bite. Mm-hmm. But of course, it's something that you not always have it. So maybe the emphasis is not in there.
Yeah.
Maybe the emphasis is improving your health. The emphasis is on breathing, because it's really affecting your health dramatically. So many people, even though they see this clause, they're okay going through the treatment because it's really causing a big problem in their marriages. Mm-hmm. Many of these people, they snore a lot. So they want to take care of that situation first.
Did you know about the risks beforehand? And
I didn't.
You didn't?
No, I looked back, and this was a dentist that I got referred to, so didn't have a relationship, and kind of shame on me to not do my due diligence on talking to him and even getting other opinions, because he had. I thought it was odd when I asked him if he had one. He said, "Yeah, I use it a couple times a week." And it's like, okay, then so as after the fact, it's like, okay, well, why wouldn't, if it helps him, why wouldn't he use it every night? Mm-hmm. And
regularly.
So he didn't communicate the risk, and so the dentist that made, it was just kind of like this jig that the dentist called it, that would hold my mouth open, right? It wouldn't move my jaw. They made for me to help me, try to still get kind of the results of something like that, where it just opens up your airway. When I went to them, they communicated similarly as Dr. Chang, just how frustrating it is that so many dentists are doing this and they're not communicating clearly on the front end, because the woman that specializes in making those mouthpieces, she says, I can't tell you how many people I see. And to Dr. Chang's point, it's powerful, and I wore mine for 1 year, and so if I would have worn it for 3 years, I don't know how far my jaw moved, but in 1 year's time, my teeth were aligned, and so I can guarantee you in another
one more year,
it would have been.
They would have been overlapping.
Yeah, and so, which would make it all the more complicated.
Mm-hmm. And double the time to fix.
Yeah, probably.
Which reminds me that you said Jeff was really an ideal patient.
Oh yeah.
Because he followed all of the instructions
Exactly.
and really just blew quickly through this treatment.
Yeah. So in this treatment with gunmetal HY arch wire, the patient has to wear the rubber bands, and wearing rubber bands is a tough deal. I mean, especially for a working, individual. Having rubber on the front while you are talking in public is tough. But as you were able to do that, we were able to move, especially the motors, really quick. So in a matter of months, we've seen the open bite close. Obviously, we took almost 2 years because I had to do some more detailing on other areas.
Mm-hmm.
Okay. So you're done with treatment though, right?
Yeah, just retainers.
Just the retainers
Yeah,
now?
yeah.
And is he still an ideal patient with
Oh,
keeping
yeah.
up with his retainers?
Absolutely. Yes.
So what's the outcome with your sleep though now? If you're not using that device, are you back to snoring? Are you sleeping well?
I sleep better. Without going into all I haven't slept good my entire life. So, as a child, had like adenoids and tonsils taken out because I snored, but it's definitely better. So,
Really?
yeah.
Your sleep now is better than ever in your life?
Yeah. So and that's what Dr. Chang, it's not just, hey, let's look at your teeth and try to realign them. He looked at like my throat and he could tell that like my airway was narrow, thus, making snoring likely a bigger issue for someone like myself. And, and I was like, well, can you improve? He said, yes, it'll improve. I don't know how much, but it will improve. And so I'm not going to say I don't ever snore. I wish it was like, hey, I had
That's
sleep
okay, I'm
apnea
sure I probably do
and
too.
I,
It's fine.
now I sleep 10 hours straight, no problem. I mean, that's not the case, but there definitely has.
But you're sleeping better.
Yes. So
A definite noticeable improvement.
Yeah. And so, I saw Dr. Chang because yes, sleeping was, anything that I view as a good option to help my sleeping, I'll, entertain that. But it, was more of, all right, taking that holistic approach that when all of your teeth, Stephanie, the physical therapist, she talked about, when all of your teeth are hitting how they should, that kind of closes that chain in your system, so provides more stability in your body. And then, I'd say the main reason is, if two teeth are hitting on each side, it's kind of you got to do something.
You got to do something because you're only chewing with two teeth. You're only at rest with just those two teeth touching. That's not
and so
sustainable.
and then just knowing that the complexity of what had gone on with my jaw, that Dr. Chang was confident that he could fix the problem if I did my part and was adherent to his recommendations. But really the other option would be to have surgery and have my jaw broken and then have quote unquote regular braces, which I would be more than happy to have a lot of rubber bands and thicker wires than to go
and
through.
A broken jaw. And that's absolutely not your philosophy. You would say that would be not a great recommendation to have that surgery. Why is that? Tell me about your thoughts on that.
Just like Jeff, I mean, this problem happens because there was environmental change. There was a reason the teeth did perfect in the sense that it adapted to the new environment, adapted too well, I would say. So if you reverse that environment, the jaw, the teeth, everything should go back to the original state. And that's what orthodontic treatment should aim for. However, having said that, typical orthodontic treatment is extremely hard to do certain movement of your motors. Whereas with this technique, the gunmetal HY arch wire, or traditionally known as the multi-loop HY arch wire, can move those lower motors in to allow contacts on the forward teeth every time. And then suddenly your jaw is able now to adapt forward and counter-rotate in the opposite direction. And
something else just to chime in, I thought was interesting when I met with Dr. Chang a couple of weeks ago and just asking about retainer. I'm fine wearing it every night. He said, actually, I'd like you to wear it, every other night and, lessen, which, just thinking about that more later, and, it makes sense that if you're kind of realigning your body into more of a equilibrium state, things would stay. And I contrast that to someone that I know that had the jaw surgery and then braces, and she's got a permanent retainer on the bottom. And to Dr. Chang's point, it's a much more unnatural route, and therefore that permanent retainer is there because the body is trying to, find that equilibrium versus, his method is, it's more holistic, and you can get your body into more of a equilibrium state. Therefore, it's not going to be fighting against. It's like, hey, the teeth want to move this direction or want to move that direction, and you have to fight it with a permanent retainer. So I thought that was interesting.
Yeah, you mentioned something really, really interesting, because still today, many orthodontists believe in the fixed retainer, the wire, believing that that will hold the teeth in place. Yes, it can hold those 6 teeth in place, but they can still flare. They can still move back in the entire whole block of 6 teeth, go back, because they are still prone to the forces that we place into our teeth, lips, tongue, or the way how you move your muscles of the jaw. All that affects to the position of the teeth. The reason why I feel good about you not wearing the retainer, down the road, is because your teeth will be your own retainer. The way how the contact that forms every time you move your jaw sideways is very symmetric. I'm not going to say it's perfect, but left and right are very symmetric contact-wise. And when you move your jaw forward, we are, glad that you have the right four contacts that I envision. And I use the word glad because not in all the cases you can achieve that, because it's related to the anatomy of teeth as well. In your particular case, your anatomy is ideal. Your left and right are very similar, so I was, able to achieve that. Whereas other patients, even though I try my best, it's impossible to do that. It's just there are so many differences in the left and right side.
Gotcha. And these devices that started this problem for you, this is not just a men-only problem. I mean, this is men and women both. So if there's anybody watching who's had a similar situation to Jeff, what do you recommend for them?
So going to your first point, this is sleep apnea is not a problem of a male,
right,
with a thick neck. That's what we believe, but a significant percentage affect females and with a small body shape for some reason. So on those patients, having sleep appliance is one solution to it, or maybe temporary solution. But I would say to consider orthodontic treatment with the mind of getting as a main objective function, getting a jaw position where it's stable, and then those lateral movement, all the functional movement of the jaw being within the envelope of function.
Dr. Chang, Jeff, thank you for having this discussion with us today.
Thank you.
Thank you.
We are again at Eline Orthodontics in Frisco, Texas. Thanks for watching.